The state is directing $100 million in additional aid to 4 communities that have been hit hard by the pandemic, but still ended up with much less federal help in the latest COVID relief bill. Today, Governor Charlie Baker announced that money will go to Chelsea, Everett, Methuen, and Randolph, which all got significantly less in funding than communities like Newton, Cambridge, and Brookline.
We believe it's critically important that these communities get the resources that they need to continue to recover from the devastating effects of the pandemic.
The governor also announced the state is launching a new program to vaccinate homebound residents using an influx of single-shot Johnson & Johnson vaccine doses. Baker said today close to 1 in 3 people in the state have gotten at least 1 dose of a COVID vaccine. And for people 75 years and older who are at higher risk from the virus, it is a whole lot higher, with more than 80% at least partially vaccinated. But as vaccinations tick up, so are new cases of the virus, including the new, more contagious variants.
We're now seeing more positive cases for a different age demographic, people under the age of 30. While these residents are far less likely to be hospitalized, it remains critically important for all residents, and especially young people, to continue to practice prevention strategies and not let down their guard. We urge the public to continue to be vigilant with respect to the virus. Vaccines are here, and that's a great thing, but we're still in a race against time.
And as we race to vaccinate faster than the virus can mutate, a new report published by the Department of Health and Human Services is giving us a clearer look at just how hard the past year plus of the pandemic has been on the nation's hospitals, with one nursing director calling for long-term solutions to address staff fatigue, compassion fatigue, and possible PTSD, so that we can help our staff be able to care for themselves, their families, and our patients. I'm joined by Barry Bloom, a professor of immunology and infectious disease at Harvard's Chan School of Public Health. He's also served as an advisor to the World Health Organization, the NIH, the CDC, and the Carter White House. Also, Sandra Bliss Nelson, an infectious disease physician at Mass General Hospital and an assistant professor at Harvard Medical School. Thank you both for being here.
Thank you.
Barry, let me start with you. I would love to get your take on where we are at here in Massachusetts in terms of the pandemic's evolution. Because on the one hand, there are some things that seem to be going really well. Vaccination rates are ticking up, even though some groups lag behind. The state is reopening, which sends a message that things are going well. Kids are heading back to school for in-person learning. And yet, I was just looking today at the New York Times' visual breakdown of cases in Massachusetts. We are much better off than we were this past winter, but we aren't in as good shape as we were last summer. And after plateauing, the cases seem to be spiking again. So do you think we're going in the wrong direction right now or the right direction?
I would quote my friend Tony Fauci, the director of National Institute of Allergy and Infectious Diseases. He basically said we're at a corner, and we either round the corner and move into summer, warmer weather, more people outside, more people vaccinated, people still remaining with masks, and doing good public health control. And as the vaccine spread, the numbers will go down. If we do what we've seen in Miami and believe it's all over, we will not round that corner. And looming in the future, if we don't round that corner, are new variant strains that seem to be more infectious, so it'll be harder later than it is now.
Sandy, what's your take on our moment?
You know, I think I really agree entirely, and I certainly would never disagree with the eminent Dr. Fauci. I would call it also a bit of an inflection point. And I think the question about are we on the right direction or the wrong direction really depends on what the destination is. And if the destination is fewer hospitalizations and fewer deaths, I do think that we are on the right direction. We are vaccinating our most vulnerable individuals, and we are preventing hospitalization and death. And that, I think, is the most important first goal. But if our destination is normalcy and getting back to a life where we can go to restaurants and we can have dinner with our friends and we can socialize indoors, I'm not sure we're really making a big dent in that effort. I think we have a lot longer to go to get to that point.
I'd love to hear from both of you. Are there steps that here in Massachusetts we either should be taking that we are not, or steps that have been taken that you think shouldn't have been taken?
I could start with that, and I hope this isn't too techy an answer. We rely on a really sensitive and accurate test that is expensive, hard to do, and the testing numbers have not gone up to the extent that we actually can follow every nook and cranny of Massachusetts as where new cases are occurring, and hence figure out how to prevent them. There is a paper that just came out today in Slovenia looking at rapid tests that have been advocated by one of my colleagues at the Harvard Chan School. They're cheap, they're rapid, and the impact of finding out where people are that are newly infected over a week or 2 week period has dropped the transmission by about 50%, and the accuracy is not perfect. But we're not interested in the numbers. We're interested in preventing transmission, isolating people that are in contact, and quarantining those who may be transmitters. That's what we haven't done in this country well.
Sandy, would you add anything there?
You know, I certainly agree completely. We need to continue testing. We need to test more. We need to test more people who are asymptomatic so we can follow the direction, the trends in people who otherwise aren't exhibiting symptoms. But I would also look a little bit more sort of on a policy level. And I do think when you compare where we are now in terms of the amount of circulating virus as measured by the known cases, we're really at a place that I think doesn't quite allow the level of congregation that we have decided to embrace as a state and as a community. And I do worry that our priorities right now are really to resume some kind of normalcy before we're ready to do that from a public health standpoint. So I would urge some degree of caution in the reopening until the numbers and the vaccine prevalence go up a little bit more.
One thing, by the way, that I have been struck by as a non-expert, unlike you two, is that when you are told that it's okay to do certain things, like, for example, start gathering in bigger numbers, go back into restaurants in higher numbers, go back to school to learn in person, it seems to me that implies to at least some people that it's okay to do other things too. I live in Swampscott, where a bunch of students recently decided that they were going to get together inside and do whatever else high school students do when they're getting together inside, and it became the biggest spreading event in the community over the course of the pandemic. So am I right that that's a domino effect that we need to watch out for?
Absolutely. I think Sandy's absolutely right. If you let our guard down, and I think the time frame is between 2 and 3 months, if we can keep the curve going down, not just staying flat, but going down, we will have enough vaccines out there so a great many more people, including younger people, will have an opportunity to be vaccinated.
I want to ask both of you about the AstraZeneca, what seems to me to be the AstraZeneca mess. I have tried to understand what's been going on as it went from people in Europe being worried about blood clots or excessive platelet formation. I might be right. I know they were worried about blood clots. And then in the United States, regulators being worried about data that hadn't been presented correctly. Can you two give me and anyone watching like me who doesn't fully get this yet a layperson's guide to what happened with AstraZeneca's vaccine and what the implications could be?
Perhaps I could start on that as well. What I always like to preface by my thoughts on vaccines are the most important ingredient in any vaccine is trust. And what AstraZeneca has managed to do is instill a lack of trust in probably a pretty good vaccine. And I say pretty good because if they presented all of the data when it was requested by the advisory committees, I wouldn't have to say probably all the data. We would know the data. This has been a problem at 2 levels. The major one is something I think people have difficulty understanding. When you run a trial with 32,000 people, some people are going to have heart attacks. Some people are going to have clotting events. Some people are going to get run over by a car. And some people are going to commit suicide. And the challenge is, if that occurs 2 weeks or a month after a vaccine, how do you know which events are caused by the vaccine and which not? And one of the ways you do that is you look at what's the incidence of heart attacks, suicides, automobile accidents before people got vaccinated. And if you look at those numbers from Europe and Africa, we're talking about 2 incidents per million people. So the numbers are absolutely so low, they can't be distinguished between what would happen if people didn't get a vaccine. And if I could say one more thing is, in a sense, the troubles of the AstraZeneca vaccine represents the success of the review system at the FDA and the CDC, which is looking at every bit of data and with a fine-tooth comb, checking on their numbers, checking on the statistical numbers for any adverse effect that's reported, and all adverse effects are reported. So when they finally approve something, the public should be damn sure it's as safe as we know how to get it.
I like that upbeat gloss, the regulatory system actually working in this case, even if the company didn't handle things especially well. Sandy, I want to ask you about that study that we mentioned, the hospital survey that was just released, finding these incredibly high rates of stress, burnout, and something approaching PTSD on the part of people who have been providing care over the past year. Is that something that you have witnessed yourself firsthand at all?
Oh, undoubtedly so. I think the last year has been incredibly taxing for healthcare workers. And I think the persistence and the recurrence of these surges where things seem to get better, and then we just have to brace ourselves knowing that it's going to get worse again. There was nothing like that first surge. That first surge was really brutal for us. March, April of last year, we were facing a pathogen we didn't really know how to care for. We were worried about our own health. We were worried about the health of our families. In some cases, we didn't have enough personal protective equipment, and that there was a tremendous exhaustion and fatigue as our hospital systems were just overloaded. And I think we all look back there when we remember that time, and we just don't want to go there again. And as we see these cases begin to trickle up again, we're really worried about what that means. I will say that we've learned a lot from these hardships, and we have made process changes that have really been effective, at least at my institution, so that there's the workload is more evenly distributed. We are much better now at caring for patients than we were. The death rates are lower. We certainly feel much more comfortable knowing how to protect ourselves. We're not worried anymore about bringing disease home to our family. I think the other piece that has really been positive is that it has highlighted the need for us to focus on our own wellness. And there have been a number of initiatives that have been rolled out, at least at my institution, to really focus on ensuring that we have safe places where we can discuss how it feels, where we can really seek help if we need it, if we're unusually anxious. And we even have open forums for reflection. Even as recently as this week, my division got together for a Zoom meeting where we really talked about what the impact of that last year has felt like for us. And there were some laughs and there were some tears, and all of that was okay. So I think we're in a better place than we were, but I will agree completely, it is exhausting.
On that note, Sandy Bliss Nelson, Barry Bloom, thank you both for taking time to talk this through.
Thank you so much.
Thank you for having us.